COVID-19 may as well be the most disruptive event of the 21st century, even more so than the 2008 recession. Millions of people were forced to stay at their homes with limited contact with one another. Hundreds of thousands of people have, unfortunately, met their ends at the hands of this coronavirus. We may think that there has never been such a catastrophic world pandemic, but what if you were told that there in fact was a pandemic even worse than our current situation in the previous century? So, just what exactly happened when humanity last encountered a pandemic? We know that COVID-19 is, at the time of this video, an ongoing crisis that began in Wuhan, China in late 2019. The very name COVID-19 means Coronavirus Disease 2019. The Spanish flu, on the other hand, occurred just slightly over a century ago, in 1918, with the First World War coming to a close as its backdrop. In 2020, the world is connected by online media through platforms such as Facebook and Instagram, with news and information readily available at our fingertips in many different formats, such as, say, video. But during the 1910s, radio had barely existed for more than a decade, and the motion picture would only start growing in popularity the next decade. Newspapers dominated the portrayal of world events back then. Not only is the world better connected by media in 2020, but also by travel. Thousands of aeroplanes dominated the sky at the beginning of 2020. By 1918, it had only been a short while after the Wright brothers invented the plane, and these flying machines were used during the First World War. But these early feats of aviation lacked a few things that their modern counterparts had: the capacity of passengers and the distance that they could travel. Due to the advent of the modern aeroplane, any person could travel from, say, Botswana to Canada in a mere few hours at much cheaper prices than in the past. Mass commuting across the globe has now made the world more connected than in 1918. These two different levels of connectivity have proved to be very important in how each crisis was made worse and handled. But not only that, the developments in medicine are drastic. By 1918, penicillin would still only be invented in 10 years' time. 2020, on the other hand, has made strides way past that, to the point where we are targeting genetic diseases with genetic engineering technologies such as CRISPR. Healthcare in 2020 is much more accessible and affordable to people in developed countries than it was back in 1918, when the world was still reeling from the First World War. Not only has healthcare improved, but general welfare as well. So that means that education standards on hygiene have increased as well. These two different levels of general health developments and welfare of citizens has also affected the difference in the response of COVID-19 compared to the Spanish flu.
In order to prevent the spread of COVID-19 and get back to our normal lives, which, we must admit, won't be as normal as they were before, we need to understand the biology of it. After all, scientists had to do the same thing in order to stop the spread of the Spanish flu in the early 20th century. First, let's take a look at COVID. Also known as SARS-CoV-2, this virus has been linked to wet markets in China where animals are sold, live. Specifically, it's said to have come from the pangolin, an animal whose scales are said to have medicinal properties and are widely consumed. Another animal that may have contributed to the initial development of the virus is the horseshoe bat. But what made these wet markets so susceptible to the virus? Many of the animals that are contained in these wet markets are placed very close to each other, and they're often stressed and dehydrated, only adding on to the risk of a virus being created. To only add on to this, blood and fecal matter from animals can be found all over these markets, creating a huge risk for those who work and visit them. The name corona comes from the Latin word for crown, and it's named for the crown-shaped proteins on its surface that help it attach to and infect healthy cells. An April 2020 study done by Cornell University showed two properties that made the virus so contagious: a loop in the structure of the spike protein on the surface of it that allows it to enter the cell more easily, and the 4 amino acids in this loop that have never been observed in another coronavirus up until this point. According to the WHO, it has a mortality rate of 3 to 4%, a huge number compared to the seasonal flu, which has a mortality rate of just 0.1%. But what did COVID-19 influence? Well, it's influenced the economy, but not always in a good way. The stock market crash of 2020 saw stock prices plummet and many businesses filing for bankruptcy, causing investors to lose millions of dollars. However, since the pandemic started and everyone's been stuck at home, streaming and video calling services like Netflix and Zoom have become more widely used, causing their stock prices to increase. Millions of people have lost their jobs during the pandemic, and tens of new government programs have been created to supply these people with steady income, at least until the pandemic is over. Many distributors that get products from point A to point B have put a halt to their operations, causing the prices for certain imported products to skyrocket. Everyone also learned how to interact through a computer screen rather than in person, with the introduction of virtual concerts, classes, and meetings. However, this pandemic has sparked much protesting from people who just want to get back to their normal lives, like the ones in Michigan, as well as much hatred toward the East Asian community and other parts of the world has been expressed, even though none of them actually contributed to the virus. The pandemic has exposed the homework gap around the world. In fact, 1 in 3 American students and employees don't have the sufficient internet or computer hardware required to communicate with their classes or colleagues online. The COVID-19 pandemic has had huge impacts that we never even knew were going to occur when it all started. But what we can do from now on is work to prevent them in the event that this happens again. Now, let's take a look at the Spanish flu, also known as the 1918 flu pandemic. It was a strain of the H1N1 virus, and, like the COVID-19 virus, was most harmful to the respiratory system and affected the breathing of the victim. It isn't known where the virus originated, but Spain was hit hardest at the beginning, hence the name. The main symptoms included the skin turning blue and the lungs filling with liquid due to a form of pneumonia that occurred as a result of the virus. Unlike most other lethal viruses, the Spanish flu was most deadly to those aged 20 to 40. In fact, it was so deadly that its mortality rate was calculated at a whopping 2.5%. While other strains of influenza had rates of less than 0.1%. It was so deadly and widespread that the average age of an American reduced by 12 years. Luckily, though, the pandemic only lasted for a year, with the virus itself mutating in such a way that it wasn't harmful to people anymore. When the pandemic was lifted, over 500 million people, 1/3 of the world population in those days, were infected, with the number of deaths being between 20 and 50 million. Some sources say that the death toll could have reached over 100 million, making it one of the worst pandemics in our world's history. The Spanish flu pandemic had a lot of impacts, economically and socially, many of whose solutions have been implemented in different places during the COVID-19 pandemic. The virus was so infectious that there were fines for going outside without a reason. Back then, they were usually around $5. Which is equal to around $80 today after adjusting for inflation. It was so bad that garbage and mail collection services had to stop because the government didn't want more people contracting the virus. One interesting thing that happened was that cities that didn't pour millions of dollars into importing drugs for the treatment of the virus or creating a vaccine, but forgot to place restrictions on people making contacts with others, were hit far worse than cities that instead used non-pharmaceutical approaches to stop the spread. Bans on spitting were passed, many hospitals worked behind closed doors, schools were closed, events were canceled as a result of this pandemic, and it seems we're taking the same steps to stop COVID-19.
As you can see, in terms of mortality, COVID-19 is not as bad as the Spanish flu. We are now much better equipped to handle a large pandemic than we were in the 20s. In other words, we learned something from the Spanish flu. Science has advanced drastically in just 100 years, and not just medicine either. With advances in technology, we are able to do things like track people that have contracted the virus and attend to patients remotely. Take, for example, South Korea. The government developed an app that tracks those that have contracted the disease and uses that data to track the progress of the virus throughout the country. Those that have the app installed receive notifications when a new case is determined in their area, though the app does not say who the infected person is so as to protect their identity. Of course, there are concerns regarding the privacy of citizens and how this data is going to be used in the future. But it has proven highly effective in slowing the COVID-19 pandemic in South Korea for the present time. We are also seeing the implementation of telemedicine as a way for doctors to treat their patients while still maintaining social distance. Instead of visits to the doctor's office, doctors can check in on their patients from safely behind the screen of their phone or laptop, all while the patient is comfortably at home. But telemedicine is even being implemented in hospitals and long-term care homes. Telemedicine companies have developed robots that assist nurses in the care of patients by projecting a live video of the doctor. With this, doctors can still treat their patients, or rather, instruct the nurses on how to treat the patients without putting themselves in harm's way. Interestingly enough, telemedicine isn't even that new. It was first used by NASA to attend to astronauts back in the 1960s, but it has only come to the forefront of medical thought during this pandemic. As you can see, the war on disease is no longer fought on a purely medical front. It has evolved to incorporate everything from computers to artificial intelligence. The general public is also more aware of the dangers regarding this pandemic, making policies like quarantine and self-isolation much easier to enforce. Knowledge is power, after all. This idea of knowledge of power wasn't actually widely implemented during the Spanish flu, as governments didn't want to seem weak to the rest of the world. This was World War I, after all. Though this may have seemed justified at the time, we know it had disastrous consequences, far outstripping the casualties of World War I. In fact, this is where the Spanish flu got its name. Most experts agree that the Spanish flu didn't originate in Spain, but due to media censorship, only Spain was reporting on it, thus the name. While widespread censorship is now fairly uncommon, we still see governments try to downplay the coronavirus pandemic, a truly unacceptable decision considering we don't have the excuse of lowering people's morale anymore.
So, to recap, COVID-19 started in Wuhan, Hubei, China sometime in December. The Spanish flu, on the other hand, started just after World War I in 1918. Our newer connections, like airplanes, make it easier for COVID-19 to spread, but our governments know more about how to handle pandemics, also slowing spread in the process. Both viruses were extremely contagious and can be deadly in your respiratory system. But we have come so far from the Spanish flu. We have technologies and methods like contact tracing, and we are able to develop vaccines faster. We know more about pandemics as a whole, and we know how to prevent spread. You will probably see that in many parts of the world, such as Switzerland and Germany, the number of new cases continues to fall, which is encouraging. But we must be careful. In the next couple of months, we will see many more countries start to reopen. While this is welcome news, we have to be careful of more waves of the virus. As people start getting together more, we may see an increase in new cases. Governments will continue to enforce physical distancing, as we do not want another wave of infections. You may also start to see more vaccines being tested. Proposed vaccines, such as the mRNA vaccine by the company Moderna, will test in larger groups, bringing us one step closer to beating this pandemic. Now, this information is not intended to scare you, but rather, it is to encourage you to beat the odds and come out of this stronger than ever. If you enjoyed that video, go ahead and click that like button for more content like this, and please subscribe.